Hello, I hope you're doing well today. My name is Mark Molinaro, and I'm a third-year pharmacy student at the University of Georgia College of Pharmacy. I'm here to show you how to do blood glucose testing in accordance with meeting the requirements put forth by our local APhA-ASP chapter. It is very important to know how to both safely and properly obtain a blood glucose sample so that we can provide the best patient care possible. The first thing you want to do to make sure is that your blood glucose monitor is calibrated. This will most likely be done by one of our faculty members here on campus, but it's always good to just make sure that it is done so that we do not have any falsely reported readings when it comes to getting a patient's blood glucose. So once you have your blood glucose monitor calibrated, it's always good to make sure you have all the necessary supplies you need for the screening. So we'll have our Cavi wipes, our gloves, our hand sanitizer, the monitor itself and the lancet, cotton ball, Band-Aid, alcohol pad, and a sharps container. Alright, so now that we have our patient here with us today, we're going to go ahead and get our hands clean. So go ahead and apply hand sanitizer and make sure you rub it vigorously around your hands, between your fingers, everywhere. Just make sure you have clean hands to prevent the spread of germs. And then we're going to put on our gloves. And when you are doing point of care testing like this, you have to change your gloves in between each patient. So it's very important to make sure that every time you finish with a patient, take the gloves off and dispose of them and get a new pair on. Alright, so now that we got our gloves on, let's go ahead and get our patient's finger ready to get the blood sample from. So if you wouldn't mind, which finger would you like for me to use?
The pinky finger.
Pinky? Alright. Go ahead and get this out. Now when you wipe the patient's finger, make sure you wipe towards you, just so we can cover all the area with wiping all the bacteria in one direction. Okay, now we're going to let that air off for just a couple seconds. While it's airing off, we're going to go ahead and set up our blood glucose monitor. So we take a test strip from the case and put it down, and make sure when you get your test strip, always close the case, because humidity can affect the test strips and we do not want them to be ruined. So now when we're inserting our test strip, just put it in the bottom here, and the monitor should come on automatically. So you don't have to turn it on or anything. As soon as you put a test strip in, it turns on itself. And also this little logo in the bottom here saying that it's requiring a drop of blood. Okay. Excuse me. So now that we have that done, we're going to go ahead and get our lancet ready. So for these, you're going to twist and pull it. Okay. And now that the patient's finger is dry, we're going to go ahead and place the lancet on the side of the finger, not on the top. As we go to the top, we might penetrate their bone, and that'll be very painful. We're going to press the button on the top to release the lancet. It's going to make a click. And we're going to place the lancet in a sharps container as quickly as possible. Okay, so now that we got, you might have to milk the fingers sometimes to get a drop of blood. Now remember, for blood glucose, you do not have to wipe the first drop of blood off. That is only for cholesterol testing. So once we got a drop of blood, go ahead and slowly approach the test strip to that drop of blood, and it will kind of suck it up itself using capillary action. That's just normally how your blood will work. And we're going to ask the patient to hold a cotton ball to their finger, if you don't mind holding that there. Thank you. And this will give us our blood glucose results. And depending on the results, we'll counsel the patient appropriately. So now that we're done with that, we'll go ahead and get our Band-Aid. I'm going to go ahead and apply it to the patient's finger. You know what? I'll take that cotton ball from you and wrap this around. I think the other side got stuck a little here. Okay. Alright, so we're done with that. And we got our glucose monitor reading, but once we're done, we're gonna go ahead and dispose of the test strip in the sharps container. So this button on the bottom here, you press this button just to release the test strip. So you'll just easily hold it over the sharps container, press the button, it'll release itself. And after that, we are finished.